replication incompetent, so it can't cause disease. All of which are very effective, all of which are safe. All are very good at preventing death and hospitalizations, ICU stays and such. You know, I wanted to come back because there's still people who are a bit concerned saying, well, you know, when I read the numbers from the studies, the Johnson & Johnson vaccine doesn't quite look as good as the other two vaccines. They're between, depending on the population, between 60 and 80% effective, or the messenger RNAs are 95. So here's some things to chew on about that. One is that these studies were all done differently and in different groups of people, and the Johnson & Johnson vaccine picked the variants in South Africa and Brazil for a good amount of their study population, and looked pretty good against them, actually. In fact, good enough so that those countries who have problems with those variants are picking Johnson & Johnson vaccine as their preferred vaccine for their populations. If they can't get the messenger RNA vaccines, which they also are happy to do. But the second thing is that when you're comparing efficacy between clinical trials, it's not apples to apples. It's apples to Bradford pears, kind of, in a way. So, so when you can do those comparisons, what you have to do is look at the protective efficacy for a population of people who might have a certain level of transmission. So if you look at moderate transmission from COVID, and then you look at protective efficacy about how many people would actually get COVID, how many people would be exposed, and then how many people would have been protected, the level of protection from the Johnson & Johnson vaccine is really equivalent to the two messenger RNA vaccines, and it's about 0.05%. So it's less than 0.1%. So if you've been vaccinated with any of these vaccines and you're exposed, or you're just out in the community doing things like you normally do, your risk of getting COVID is about less than a 0.1%. So that's pretty darn good. So the best vaccine is the one you can get the quickest, and I still stand by that. One advantage of Johnson & Johnson's vaccine is right now it's one shot and you're done, and so you don't have to schedule or come back for the second shot. For some people, that's actually quite an advantage. So we're having more vaccine available still. I think that over the next 3 or 4 weeks, we're going to see a lot rolling out into the states, including our state. And so there's going to be our health systems, our counties, our state, the federal government and FEMA and Greensboro are all going to be ramping up to get these things out there. So more and more people who have their hunting license are actually going to be able to bag their vaccine, and that's a good thing. So keep an eye on the websites for when your priority comes up and to get your appointment. The health systems are doing a lot to get to the historically marginalized populations, particularly the Hispanic population. The uptick's been really kind of slow and sluggish. So mobile vaccine units, getting out to the places of faith, working with faith-based areas, going actually to the zip codes that have the higher proportions of historically marginalized populations. And the FEMA, the federal government's program, has what they call a spoke program where they distribute vaccine out specifically for certain zip codes in certain areas, and our health systems are working here in our area to get vaccine to those places. And so this is all very important because we want to lift all boats. And so everyone has an opportunity to get vaccinated, and we want to make sure that people understand that the vaccines are safe and effective. And so we're still working on that, and will be for several months into the future. The priority group right now for getting vaccinated, when you go to the state website and what the state has put in, is basically frontline workers who are really on the front line, meeting people. So think grocery store workers, convenience workers, fast food people, still teachers, people in universities who are working with students, counselors who are working with people, mental health professionals, people who are working in courthouses, such and so forth. So the people who are doing essential jobs, but not technically meeting a lot of people all the time, are in group 4, which is coming up on 2 weeks from now, actually, March 24th. So there's a lot of gray areas in there, I know, and when you sign up on the websites, each county's sign-up system's a little different, and sometimes it gets a little confusing. Just a little bit of an appeal that if you're really not in the priority group, be a good citizen and wait a couple weeks. But we also have to be cognizant when you see people in the line at the vaccine place. You don't know if they work at a grocery store. You don't know if they're a teacher. You don't know if they have a real priority reason to be there. So it's on the honor system, so let's all be honorable. The one group that has not yet hit the priority but will on the 24th is a group that's really feeling the pinch, and these are people with underlying health conditions, particularly being overweight, having diabetes, heart disease, lung disease, kidney disease, so on and so forth. Well, some of the kidney disease people have been vaccinated through their dialysis centers, but there's a lot of people with underlying health conditions that haven't had a chance to get vaccinated yet. So we have to be respectful of them. And their turn comes up on March 24th. So we look forward to that. This week, the CDC came out with recommendations about what people can do once they've been fully vaccinated. And for the most part, they followed exactly what I've been talking about here for the last 2 to 3 weeks. And I love it when the CDC agrees with me. But so you have to remember a few things about the CDC guidelines when you go to them or where you read about them in the media, is that they're basically oriented towards households. Okay, so what can I do with my family? What can I do as an individual? What can I do with people? And the big things they say that I agree with totally are that if you've been fully vaccinated and you're getting together, you plan to get together with other fully vaccinated people, and you're going to do it indoors, you can do it without masks if you're basically doing it with one other household or very small groups of people. And then if you get multiple households together indoors, though, even if you're all vaccinated, you should still be taking precautions. Taking outdoors, wear masks, so on and so forth. But this means that people visiting relatives who have been fully vaccinated, like visiting the grandparents and such, is an okay thing to do. And they even go on to say is that if there's some mixture, like some unvaccinated people, but the people you're visiting are fully vaccinated, it's okay as long as there's not people who in the unvaccinated group are at high risk. And so you can, and I agree with that too, you can look at the numbers. One thing though that I think is a little bit, I differ a little bit from the CDC, that if you're going to be visiting grandparents or another family who are vaccinated and you're bringing along older kids, middle school, high school kids, probably should mask still and distance some, because that's an unvaccinated group of people who tend to be asymptomatic when they get infected, so you might not know they have it, and they're particularly as spring comes on, they're getting to be a pretty social group. So if you have kids, older kids particularly, and you're visiting the grandparents, even if the grandparents have been vaccinated, I'd take some precautions. And if you're indoors, wear the mask. If you're outdoors, I think you can take the mask off. So that is the I'm going to go ahead and cut off right now, if that's okay, and we'll come back. We have something to tend to here in our room.